So you're thinking about breast augmentation and you have a lot of questions. Not to worry, I'm Dr. Matthew J. Nykiel, board certified plastic surgeon, and I want to walk you through the basics of a breast augmentation. Now I made this video to apply to anybody that's watching it, but please always check with your board certified plastic surgeon to ensure that what I'm saying also matches up what that plastic surgeon thinks and what that plastic surgeon can do. In general, we have two types of implants. We have a silicone implant and we have a saline implant. Saline is salt water, so we have a silicone-filled shell and we have a saltwater filled shell. For the most part, people do silicone implants, and that's because they look better, they feel better, and they ripple less. Saltwater or saline implants are typically at this point mostly done from a price standpoint. Saline implants cost slightly less. The other reason that some people get saline implants is because a saline implant will create a overly fake cleavage look, and some people want that. Implants are put in through 4 main incisions, but really we only use 2. I want to review them all just from an educational standpoint, but I want you to remember, in practice, really only 2 get used. Number 1, you can put an implant in through the belly button. You may say, how do you do that? It's extremely difficult. And the results, most of the time, aren't that good, so we don't recommend it. Number 2, the armpit. Again, an interesting way to put an implant in. Scar hides well, but one of the main problems is the implant can never be placed medial enough from this trajectory. And it overall leaves implants that sit a little bit further out to the side and more of a gap in the middle. Overall, it's not liked, and for that reason, it doesn't get done a lot. Number 3, the areola. The areola hides a scar beautifully. However, most people's areolas are not that big, so you cannot fit certain size implants in through an areola incision. Number 2, studies show that areolar incisions actually have a higher rate of scar tissue, pretty consistently across studies. We also see a trend towards higher infections with an areolar incision. It's not statistically significant, but in many studies, we see that difference of higher infection rates. And when you think about it, if you need to go through the breast ducts, there's natural bacteria that live in them, and the idea of a higher infection rate does kind of make sense. That leads us to the 4th and most common incision placement, the fold of the breast, or the IMF incision. The reason that people like that: lowest rate of capsular contraction, the best visualization to create an implant pocket, and overall gives most people's hands the most consistent and stable results. Now, implant size is always one of the most important questions. And I think the best way to do an implant size prior to your consultation is the Rice test. And if you don't know what the Rice test is, click this link below and we'll actually show you the Rice test in action. Now, when you're in your consultation, one of the things you want to go over with your doctor when you discuss size is the most important measurement, and that is the base diameter, or how wide is that implant. You want the width of that implant to match the width of your chest. Too wide and the implant sticks off the chest and starts to look really unnatural. Too narrow and you get more of a cone shape, and again, it just doesn't look right. So base diameter or base width, in my opinion, is the most important measurement. Right along with the size, we talk about profile. And I realize that profile can be a little bit confusing. I hope to break this down and make it as easy to understand as possible. Profile refers to the 3D shape of this implant. We can have an implant, in this case, we have a 265cc implant. And that 265cc implant can be over a very wide path or wider base, and you can see that actually flattens the projection of that implant out. Or it can be over a very narrow base, and you can see it pushes the trajectory out even more. The higher the profile, the more narrow the implant, and the higher this push is. In general, the higher the profile, the faker the appearance of the implant. And that's very important. Moderate profiles are typically the most natural, what we consider natural look. Again, you have a high and an ultra high profile, and as we go up in profile highness, we create a more fake look with the implant itself. In general, breast augmentation takes about an hour to an hour and a half. It's outpatient surgery, meaning that you get to go home after surgery. Outpatient surgery only works with good, responsible adults taking care of you. You want to ensure that somebody's going to be with you at all times for the first 24 to 48 hours. Anesthesia is always a question with breast augmentation. Most people do a light general anesthesia or a max sedation. What's that mean? Max sedation means that an IV is placed and medication is given, and essentially you pass out, and when you wake up, the surgery's over. Light general means that a mask sits in your mouth, you breathe some gases, again, go to sleep, you wake up, and the surgery's done. It's very rare that we actually do general anesthesia with the endotracheal tube going down your throat for a relatively quick and easy procedure. Recovery is different for each person. In general, a week is usually sufficient time off of work. We want to take a 6-week break from the gym, and we want to take a 6-week lifting restrictions, meaning I don't want you lifting more than 15 pounds for the first 6 weeks. We have a 5-pound weight restriction week 1, a 10-pound weight restriction week 2, and then finally 15 pounds week 3 through 6. All implants are going to start high, and they take about 6 weeks to fall. They take another 6 weeks to round out, so usually start to finish is a 3-month process. Now we want those implants to fall. So for those first 6 weeks, we only want you wearing post-op bras or very loose and light sports bras. I don't want you wearing underwires or push-up bras or bras that would impede that falling of the implant to a more natural position. That's a pretty good overview of breast augmentations. But if you have more questions, take a look at our educational video series. If you want to know more, you're ready to take the next steps, schedule a consultation with us. Myself, Dr. Matthew J. Nykiel, and the SoCal Plastic Surgeons team look forward to meeting you.